Good morning, thank you. So who's tired of talking and thinking about COVID? Me too. But bear with me, I was given 5 minutes. So people have asked us lately what we're doing now that COVID is over. And I think what people are really asking is, what do you do when you're not responding to the pandemic? And how is public health moving forward with the impacts of COVID? But to answer those questions, I have to go back to the height of COVID. During that time, so much of the fundamental public health work did not stop. When you ordered takeout, you weren't concerned that you were going to have a foodborne illness. New parents learned how to install car seats. People came to our clinics for cancer screenings and birth control. That work can't stop, and it didn't. And simultaneously, we were taking on the unprecedented challenge of the pandemic. And I liken the pandemic to a race. We started out thinking it was going to be a 5K, but it ended up not only being a marathon, but an Ironman with no route mapped out. Along the way, we suffered many injuries, many of which are also still healing, but we also developed new muscles. There were times when we were out on the race route alone, and other times there were big crowds cheering for us. And then there were times that people came out of the crowd and joined the race or showed us new routes to get to the end together. We're still running and training for the next race, but at a more reasonable pace now. But businesses, public health, schools, families, healthcare workers, all of us played a role in getting through COVID. And many of us are still weathering the longer term impacts, whether that's physically, mentally, socially, financially, but we got to this point together. And COVID reminded us that we all need each other to not only survive, but to thrive. Nationally, there's been coverage on the burnout of public health workforce due to the pandemic, and I can tell you that that is real. But I also want to mention the other side, which is all of the talented and passionate people who came forward to help during the pandemic. This is the next generation of the public health workforce, and many are now serving in many different programs and services within public health. They're bringing their fresh energy and helping us build into the next phase of work. Now, while COVID is still with us, we are fortunate to be looking ahead to the next phase of health in our community. And I will say that this next phase is particularly exciting. First, because it's not COVID. Second, because we move into this next phase with the strength of the muscles that we gained throughout the pandemic. And third, because we are getting to focus on health, not just as the absence of disease, but as wellness and vitality. So as we move to the next race, how are we tackling it? One way is Slow Health Counts. Slow Health Counts is a community-wide initiative that works equitably to improve health for those who live, work, and play in SLO County by sharing the responsibility and the opportunity to improve the community's health together. Slow Health Counts members consider the many factors, including social and economic, that influence the health of our community, and then prioritize the most critical health needs. They have begun this work with the aid of COVID recovery funding and are supporting a portfolio of projects that range from addressing food access to healthy aging. Looking ahead, the work of Slow Health Counts will be aided by the Community Health Assessment. The Community Health Assessment paints a picture of the health status of our community. They will then use this assessment as they soon begin the work of developing a community health improvement plan. The plan is a roadmap on how to improve the health and well-being of our community. It identifies priorities, goals, and policy recommendations for achieving a healthy, equitable, and thriving community. And our goal is that this plan will be valuable and inspiring to organizations throughout the county, such as yours, so that we can work in concert on improving the health of our community. So this morning, as I come to you all, I ask you to protect and promote the health, vitality, and wellness of our community. And you can do this in 3 ways. First is to notice all the factors that influence health and wellness in our community. Second is to participate in the collective movement to create a community where we all have the opportunity to live healthfully. And lastly is to remember that we're all in this race together. Thank you.